There are two big reasons why tennis elbow refuses to go away and comes back again and again and again in so many people. And in this video, I'm going to tell you exactly what those are and give you a proven 3-step process that you can use to not just relieve your symptoms, but to actually repair that damaged tissue so that you can get rid of your tennis elbow once and for all. The number one reason why so many cases of tennis elbow stick around way longer than they should is a failure to provide the type of stimulus that the body must have in order to heal the injured areas in those tendons. It's important to point out that there are multiple muscle groups that attach to the lateral epicondyle of the humerus. That's why step number 1 is to pass load through all of the tissues that have the potential to be involved in this problem. And for that, we need 3 different exercises. All 3 of the exercises that we're going to be using are going to be isometrics, which is going to help us to bypass the body's compensatory mechanisms so that we can pass load through the damaged areas of those tendons. Having access to some basic exercise equipment like a flex therapy bar and these finger strengtheners can make performing the exercises that I'm about to show you more convenient and more effective too. But you don't have to worry if you don't have these things, because I'm also going to be showing you variations for all of these exercises that can be done using either no equipment or things that most people have lying around the house. Exercise number 1 is finger extension, and it's super simple. All you need to do is slide the finger exerciser onto the hand on the same side that you're having the tennis elbow. Make sure that you slide it all the way down to the base of the fingers here. That'll make the resistance level much more manageable. And then what you're going to do is start with your elbow bent all the way in and the wrist flexed, and then just press the arm out, extend the fingers and the wrist, and hold for 30 seconds continuously. When time is up, slowly allow the band to overwhelm your force, draw the hand back in, and rest. Isometric finger extension can also be performed without any equipment, and for that, what you would do is extend the arm on the same side that has the tennis elbow straight out in front of you, bring the wrist and the fingers as far back into extension as you comfortably can. You're then going to take your opposite hand and place it across the fingertips and apply forward pressure as if you were trying to fold those fingers downward like this. And of course, you're going to be resisting that downward pressure using the finger extensor muscles here on the top of the forearm. So pushing forward, resisting that force. Make sure that you're pressing across the pinky finger because that's one of the muscles that ties into the lateral epicondyle. Push for 30 seconds continuously. When time is up, slowly ramp force down, bring the arm in, and rest. Exercise number 2 is isometric wrist extension, and my favorite way of doing this, hands down, is with a flex therapy bar. To perform this exercise, extend the flex therapy bar straight out in front of you, grasp it with both hands using an overhand grip. Then, with the side that has the tennis elbow, you're going to reposition your grip, pointing the knuckles down at the floor like this, and then twist in the opposite direction, bringing those knuckles up towards the ceiling and the wrist into extension. You're then going to hold that position for 30 seconds continuously. When time is up, slowly allow those hands to go back to their neutral position, untwist the bar, rest and relax. In a pinch, isometric wrist extension can also be done with no equipment whatsoever. To do that, just extend the arm out in front of you, close your fist, bring the wrist back as far as you comfortably can into extension, then bring the opposite hand to the knuckles, and you'll be pushing forward, attempting to bend the wrist in this direction, and of course you're going to be using your wrist extensors to resist. You'll hold that position for 30 seconds continuously. When time is up, slowly allow the force of the opposite arm to overcome the wrist extensors, bringing the wrist to neutral, rest and relax. Exercise number 3 is isometric supination, which is turning the palm up towards the ceiling like that. My favorite way of performing this exercise is again using the flex therapy bar. Now you're going to start off with the bar in the hand on the side of the body that does not have the tennis elbow. You're going to grasp it using an underhand grip, and you're going to bend the elbow to 90 degrees, bringing it across your body like so. You're then going to take the hand on the side that does have the tennis elbow, grasp the opposite side of the flex therapy bar using an overhand grip, and you're going to be attempting to bend the bar in this direction, keeping the elbow tucked right into the side of your body. Here's what that looks like. Holding the bar firmly in place, in this case using my left hand, twisting using the right, trying to bring that palm up towards the ceiling, and attempting to twist in that direction for 30 seconds continuously. You're going to feel some tension begin to build right in the crease of your elbow. When time is up, slowly allow that bar to come back into its flat position, rest the muscles, and relax. Isometric supination can also easily be done using common household items. And what you're looking for specifically is something with a relatively long handle and some weight on the end. So like a hammer or a small frying pan works great for this. What you're going to do is grasp the end of the handle using the hand on the same side that the tennis elbow is happening. You're going to bend that elbow to 90 degrees, hold the hand straight out in front of you with the palm facing down as if you were trying to rotate your wrist this way, but you're just going to hold that position for 30 seconds continuously. Now, if you're using a heavier frying pan or if you've got a lot of weakness in this area, you do have the option to choke up or move your hand closer to the weight to make things lighter. As you get stronger over time, you would move your hand further and further away from the weight to increase load on the target tissue. Either way, when 30 seconds is up, you're going to slowly bring the palm to a neutral position. Take the weight out of the hand and rest. As far as sets and repetitions go, what I do with these exercises is perform them back to back in the order that I just showed you, holding each one for 30 seconds. At the end of the 3 exercises, I rest for 1 minute and I repeat that cycle 4 times. Before we move on to step number 2, there's one other important thing that I want to mention here, and that is that isometric exercises like the ones I just showed you have a unique ability to reduce pain levels. And that's great. But it can have the unwanted side effect of lulling people into a false sense of security and making them think that their problem is fixed, which leads them to stop doing their exercises. And that ties directly into the second big reason that most people fail to fully recover from tennis elbow, which is a lack of consistency and or follow-through. So keep in mind that under ideal conditions, it takes 8 weeks of consistent training to fully heal a damaged tendon. Most people understand that the pain and disability that they experience with tennis elbow is the result of tiny little tears in the various tendons that attach to the lateral epicondyle of the humerus. But what most people don't know is that those tendons are made up almost entirely of type 1 collagen. And that's why step number 2 is to make sure that you're giving your body an ample supply of the nutrients that it needs to repair that damaged tissue. Multiple studies have demonstrated that supplementing with 10 to 15 grams of high-quality collagen peptides increases the rate of collagen synthesis in the body, promotes recovery, increases the cross-sectional area and thickness of tendons, and improves strength when paired with resistance training. The other thing that you want to make absolutely certain of is that you're consuming your collagen in combination with a high-quality source of vitamin C. This large-scale review from 2022 found that vitamin C deficiency is associated with a decrease in pro-collagen synthesis and a hindering of the body's tendon repair process. Whereas vitamin C supplementation increases collagen synthesis with a, quote, consequent improvement in the patient's condition. Like I said before, it takes about 8 weeks to fully repair a damaged tendon. And because this process takes a while, it's important that you've got a strategy that you can use to relieve your symptoms that doesn't involve taking things like nonsteroidal anti-inflammatory drugs or corticosteroids, which can negatively impact the body's healing process and weaken connective tissue. And that's why step number 3 is to use rock tape to relieve pain and improve functionality. Step number 1 is to figure out exactly where you're going to place the tape. To do that, you're going to locate the lateral epicondyle, this bump here on the outside of your elbow, and then you're going to palpate around it, which is just pushing in lightly into the muscles to find the most tender area. Once you've identified that, say it's where the blue line is, then you're going to know exactly where to place your tape. You're going to start by cutting yourself a piece of rock tape that's about 5 to 6 inches long. You want to make sure that after you cut the tape, you go in and you round the edges. That'll make sure that you don't catch an edge and have the tape come off prematurely. Once you've got that, you're going to flip the tape over and you're going to tear the backing about 2 inches from the edge and peel that strip away. You're then going to go in where you had that tender spot and you're going to apply this section of tape that's exposed right over the lateral epicondyle, actually just about an inch behind it, and secure that section of tape. Use the backing to rub and activate all that adhesive. That is the anchor strip. From there, keeping the elbow bent to 90 degrees, you will peel the remaining backing, apply about a 10 to 20% stretch right over where that tender section is. Again, keeping the elbow bent to 90 degrees, lay that down, and then the last inch will go down with no stretch. And then you'll take your backing and rub to activate all the adhesive, and there's your rock tape. So now you've got a complete process that's easy to implement that'll help you to fully recover from tennis elbow once and for all. If you want to pick up rock tape, finger strengtheners, or those flex therapy bars, I'll put links for all of those in the description down below. And for anyone who is interested in using nutrition to speed up the healing process and strengthen their joints and connective tissues, I've got a brand new ebook that talks all about it, and you can access that for free with the link down in the description. Beyond that, I just want to thank you so much for watching. Make sure to hit the thumbs up button and the little subscribe button before you head out of here, and I'll see you next time.